My key thing to do today is to actually launch some principles that we've been working on, and I'm really excited to be able to do that. And I think there are two certainties that we all have in our lives, and one is that we were born and we're here, and the other is that we will die. The majority of us will live long lives and die when we are older. About 2/3 of all deaths are of people who are aged 75 years and over. And for those people who are aged 75 years and older, about 75% of those people have actually used aged care services in the 12 months before they died. So palliative care is absolutely core business for aged care providers. Aged care supports over 1 million people in their own home and in residential care every single year. And when needed, the support that's provided includes palliative and end-of-life care. And it's in recognition of this and the importance of providing the very best support to older people that Palliative Care Australia, Aged and Community Services Australia, Council on the Ageing or COSHA, Leading Age Services Australia, Catholic Health Australia and the Aged Care Guild, and some of the heads, Suzanne and Sean, are here as well today. We worked together to develop principles for palliative and end-of-life care. The principles we're launching today focus specifically on older people in residential care. And I think we've got a slide up now with what the principles are. I'm not going to spend a lot of time going through them, but what I wanted to do was tell you what they reflect on the need for us to do as aged care providers. And they reflect on the need for us to recognise when an older person in our care is approaching the end of their life. It reflects the need for us to assess, to document and to meet those changing care requirements, to ensure that they get the very best of care and they have access to high quality end-of-life care, to ensure that our residential aged care services are adequately resourced so that they can provide that care that the person needs and deserves to receive, to make sure that our staff are trained and supported in delivering end-of-life care, and to ensure that that care that's provided is holistic and seamless for the person and their family. Absolutely critical is to respect the dignity, privacy and diversity of all of those individuals that we support, including the spiritual, cultural and gender diversity that there is. And we also have to, in delivering this care, understand and meet the needs of our residents with dementia. And again, dementia care, and we're seeing many people with dementia in residential aged care who need support. We also have to, and it was interesting to hear the comments made earlier about the support that palliative care provides for families, and we too, in aged care, must provide that support for families and carers in their bereavement. And we have to appropriately acknowledge, which is what we always want to do, the contribution that that individual has made and the life that they have lived. And so each and every day, our aged care providers and residential care workers strive to deliver quality care to all and to adhere to the principles that we're launching here today in delivering palliative and end-of-life care. The principles do have some broad implications for the way aged care is supported and funded to deliver that care. I mentioned earlier that about 75% of older people who die have used aged care in the 12 months before their death. But it's interesting to note that only 1 in 25 residents actually in their care or funding appraisals have indicated that have come up that there's a need for palliative care. So in the industry, we think this is a low figure given the number of people who are in aged care. And it's why it's important that as government now is undertaking a review of residential aged care funding, many of you would be aware of that review, it's absolutely critical that as that review happens, the need for and the funding of palliative and end-of-life care is examined as part of that. The review presents us with that opportunity to get the funding right and to ensure that these principles can be enacted every day for every single resident around the country who requires palliative or end-of-life care. There are in fact some other opportunities at the moment for us to also ensure that we go beyond residential care, because as we know, most people want to stay at home, most older Australians want to stay living in their own home, and most people express the desire to die at home, but it's not the majority who get to do that. So beyond residential care, we've also got some opportunities to look at how we make sure that people get good palliative and end-of-life care. Government's currently moving to create an integrated care at home program. What are the opportunities for us in that to make sure that good palliative and end-of-life care is delivered at home? The government will shortly be considering the outcomes from the legislated review, which is looking at reforms that have been made to aged care, and that's currently being conducted by David Choom. It's another opportunity for us to look at how do we make sure that older Australians get the very best palliative and end-of-life care. And do you know what? Every time the Commonwealth and state governments of whatever persuasion they are consider health spending and priorities, it's an opportunity to consider how to provide good palliative care and particularly shift some of the priority to supporting people to die at home. And in doing all of these things, what we must all do is keep the person at the forefront. It's what aged care workers do each and every day, the nurses, the care workers, all of the staff. Because at the end of the day, it's the people that we're all there for, the older Australian, their families, and to all of those people who've been important to them or to whom that person is important, to experience a good death. We all must, and I'm going to quote from a book that shares the wisdom from 60 voices on life and death, we all must take care with the end as we do with the beginning. I commend these principles to you today in that spirit, and I want to thank you for your time. I wanted to keep my remarks brief because I think there'll be great value following these presentations in people being able to talk about the principles and the other things that have been talked about today. So thank you very much for your time.